Now we're going to go to suggestions for beautiful and healthy skin this summer. Dr. Fichadia joins us now, double board certified plastic surgeon at the Oregon Clinic. Thanks so much for being here.
Thank you for having me.
Thank you. Well, we all know that summer can be really hard on your skin. So what are some things that we really need to keep in mind and be doing this summer?
So whenever it gets to be this nice hot weather out here, we decide to go out and enjoy it. There are some things to remember as we do this. The biggest thing is protecting your skin from the damaging ultraviolet rays of the sun. Skin cancer is the #1 cancer in our country. Fortunately, it's also the most preventable cancer. Harmful rays of the sun, ultraviolet rays, and indoor tanning have been shown to be clearly associated with skin cancer. And so as we get out in this nice weather, need to remember some points that we can all use, some helpful hints that we can all do to minimize our sun exposure.
Now, is the damage done if you think, oh my gosh, all these homecomings and proms, I went in a tanning bed, and now you're thinking, oh, what could I do? What can we do now that we're smarter and wiser if we did some damage back in the day? Well,
what we can do now is avoid further damage. So use sunscreen as faithfully as possible. Apply it 20 to 30 minutes before you step out. Reapply it every 2 to 3 hours. Get a sunscreen that says broad spectrum on it, so it protects against both UVA and UVB lights, and reapply it if you get wet or sweaty.
Do you have any specific sunscreens you'd recommend for kids? Because my little girl, she has really sensitive skin and she has beautiful skin, but she breaks out a lot. Different brands I put on her.
There are some sunscreens that are for hypoallergenic skin. Something that has a zinc oxide in it will be a very good barrier to it, but that needs to be from a hypoallergenic, from a company that makes hypoallergenic products. So it'd be good one to test on the inner side of your forearm and go from there.
And should we be wearing the same sunscreen on our face and our body, or should we mix it up for different parts?
It's the same. It's the same.
Okay.
And people also sometimes tend to think that last year's sunscreen is not good, throw it away. It's not true.
Really?
Yes. So
what's the shelf life?
It's about 2 to 3 years, but after that you need to get it replaced.
And is there any safe way to get some sun, or would you just say avoid it altogether?
Is there any safe way to get some sun? Probably not, but if you are stepping out in the sun, there are things that you can do to reduce your risk, such as use of sunscreen, using goggles that cover the side of your face, wide-brimmed hats, avoiding the sun between the hours of 10 a.m. and 4 p.m. when the rays are the strongest.
Sure. What are the most missed areas? I always yell at my dad because he's a golfer, and he has bright tomato ears, like he just forgets to put sunscreen on his ears. What are some commonly missed places? Maybe our scalp, perhaps?
Yep, scalp, back of the ears, that's great, back of the neck. Those are great areas that you can focus on to make it more healthy. For people who've had exposure to tanning beds, say, or higher sun exposure at a young age, it's important to know that those things increase your risk of skin cancer. So be aware of any moles on your body. Be sure to monitor them so you notice a change in the mole, a mole that is getting larger, that is getting irregular, that is showing some more pigment. Go to your doctor, get that evaluated, because early diagnosis and treatment makes these skin cancers easily treatable when they're early.
And I've been starting just taking pictures with my phone just to kind of map them if I'm suspicious in between doctor's appointments. So
that's a great way to do it.
Very cool. Well, thank you so much for those wonderful tips. These fellas take great care of their skin. You can tell because they're beautiful. Rod and Drew, they're going to get goofy now.